Hello, I'm Lachelle Pierre, a licensed insurance broker, here to shine some light on the insurance information for you today. A lot of you may have questions as you begin to try to do a quote to obtain affordable health care. Today, we're going to explain what is a deductible, what is a copay, what does coinsurance mean, what is my out-of-pocket expense. So let's jump right into some of these common questions. So, what is a deductible? A lot of people have been asking about that because they're just not clear. Do I choose a high one? Do I choose a low one? Well, your deductible is the amount of money that you will pay before your insurance coverage kicks in. So, you need to determine what's going to be best for you. You may choose a high deductible so that you can have a lower monthly premium. And remember, the lower the deductible, the higher the monthly premium. For example, if you choose a $10,000 deductible, and I know some of you may think, oh my goodness, a $10,000 deductible, I'd never do that. But if you don't have any coverage right now, something is better than nothing. So if you choose a $10,000 deductible, that would actually give you the lowest monthly premium. And now you're able to keep more money in your pocket for things that you may need, especially if you are the type of person that only goes to the doctor maybe annually for your physicals or your routine checkups and mammograms. These things are included in your health plan, so you won't need to pay for them. If you choose a lower deductible, maybe a $500 or $1,000 deductible, your monthly premium is going to be much higher. Now, these plans are effective for those who maybe have an existing condition that requires you to make frequent doctor visits or frequent lab work and medications and things that will apply toward your deductible so that you can meet it, and now your insurance will kick in. What is a copay? A copay is the amount of money that you will pay at each of your doctor visits. Copays can range anywhere from $10 to $50, depending on the plan that you choose. So it's very important when selecting your insurance plan that you read through the requirements and understand how much the copay is. If you go to the doctor very frequently, you may want to choose a plan that has a lower copay amount because that's how much you would have to pay each time you would go. What is the out-of-pocket expense? Now, this is something that a lot of people really don't know anything about, and really they're not aware of it until they're faced with the situation where they're hospitalized and they find out they have an additional $5,000 that they owe. In your health plan, most plans will have a deductible, and that's your set amount, and you know about that, but then you'll have an out-of-pocket maximum. This is an additional amount of money. For most plans, it's in addition to your deductible that you would be required to spend before your insurance pays 100%. Again, the out-of-pocket maximum is an amount that you choose. So based on your plan, you may choose a lower out-of-pocket expense. Some can go up to $7,500, $10,000. It's up to you. But in the event that you were hospitalized, you've got to understand that that is the amount of money that you would be required to pay. Your deductible plus your out-of-pocket expense. What is coinsurance? You've probably heard the term and we're not exactly sure what that meant. Coinsurance is the percentage that the insurance company will pay and that you will pay. Most plans have a 100% coverage, and that means after your deductible, your insurance will pay 100%. Or you may have a plan with a coinsurance of 80-20. That means the insurance company, after your deductible, will pay 80% of your bills, and then you are still responsible for the additional 20%. You can have an 80-20 plan or even a 70-30 plan. And that means the insurance company pays 70%, you pay 30%. Again, there is no cookie cutter, right or wrong health plan. It's very important that you have all the facts and all the information so that you can choose a plan that's best for you and your family. What is preventive care? Preventive care is just that. It is the measures that we take to ensure our health and our wellness. This includes your annual physical, mammograms, your colonoscopies, things that we need to do to make sure that we are taking care of our bodies. And I'm so excited that because of the Healthcare Reform Act, preventive care is included in most of the health insurance plans. I know a lot of people are upset about the Healthcare Reform Act, but it's also doing some great things, and including the preventive care is one of those. So if you or your child has a routine physical each year, now there's no charge for that. And that is because of the preventive care plan that was included with the Healthcare Reform Act. Because of the new law, a lot of people have been very concerned because prior to now, you just have not been able to afford health care. Well, today we're going to show you some options of ways and things that you can do to make this option more affordable for you. If you have not had health care at all, and a lot of people are in this boat, then one of the things that we suggest is choosing a health plan with a higher deductible. As we stated earlier, a higher deductible makes your monthly premium lower. And so by doing that, it's less expense on you every month. Because of the new healthcare law, a lot of people are very concerned because prior to now, it just hasn't been affordable.